Good evening. Today's class we are going to discuss about gingival enlargement. Okay, some of the important MCQs of the gingival enlargement with its description. Every description I am giving for the MCQs is taken from Karanza. Okay. Please if you have any doubts. First, we are going to start with first MCQ. Gingival enlargement lesions that are relatively firm, resilient, and pink have greater vascular component, inflammatory cells, degenerative changes, and fibrotic component. Okay. There is a increase in vascular component, then the tissue won't be firm under. Okay. There is an increase in vascular component, the tissue won't be firm. Therefore, answer A won't be the option. And there is inflammatory cells, increase in inflammatory cells or inflammatory cell infiltration also. The tissue won't be firm at all. There will be a lot of inflammatory fluid collection will be there, and therefore answer B also won't be an answer. And degenerative changes. There is any degenerative changes also. The tissue won't be firm and resilient. It will be soggy, puffy in consistency will be present. And the tissue will be very red in color also. There is an increase in vascular component, the tissue will be very red in color, and there is an inflammatory changes and the degenerative changes is present, then the tissue won't be firm and resilient under. Only if the fibrotic component increases, the tissues will be relatively firm, resilient, and pink. Okay. Only if there is an increase in fibrotic component, the tissue will be relatively firm, resilient, and pink. Therefore, the answer should be D for this above question. Okay, answer should be D, fibrotic component. Coming to the classification of gingival enlargement, gingival enlargement is broadly classified into 5 types. First is inflammatory enlargement. Subtype will be chronic inflammatory enlargement and acute inflammatory enlargement, as seen in gingival abscess and all. And drug-induced gingival enlargement, which will be commonly arise due to intake of drugs, which will commonly arise due to intake of drugs like anticonvulsants and calcium channel blockers and immunosuppressants such as cyclosporine. Okay. Then enlargements associated with systemic disease. First is condition enlargement. Here, in condition enlargement, plaque is a major initiating factor. Okay, plaque is a major initiating factor for such enlargement. Only the conditions and the systemic diseases, it will modify it. Okay, just it will modify it. Only the systemic conditions will under conditions such as pregnancy, puberty, vitamin C deficiency, and allergic conditions such as plasma cell gingivitis will modify it. Only the condition will modify it. And there is a non-specific condition enlargement called granuloma pyogenica. Okay, non-specific condition enlargement called granuloma pyogenica or pyogenic granuloma. Okay, it is a non-specific condition enlargement. And systemic diseases also implicated with gingival enlargement. These are leukemia mostly acute monocytic leukemia and acute lymphoblastic leukemia are commonly associated with gingival enlargement, whereas chronic leukemias are not associated with gingival enlargement. And granulomatous diseases such as venous granulomatosis and sarcoidosis, venous granulomatosis, sarcoidosis, and tuberculosis are associated with granulomatous diseases associated with gingival enlargement. Okay. Next is neoplastic enlargement. Neoplastic enlargement first is benign tumors and malignant tumors. Some of the examples for benign tumors are fibromas. Fibromas are example for benign tumors, and false enlargement. Okay, false enlargement that is due to underlying expansion of the bone or underlying erupting tooth under the gingiva will appear enlarged. Therefore, it is called as false enlargement. These are all the types of gingival enlargement we are going to discuss in this chapter. Okay. Next is the chronic inflammatory gingival enlargement is caused by dental calculus. Dental calculus is just a contributing factor. Okay, it won't cause any chronic inflammatory gingival enlargement and all. Only the plaque, dental plaque, prolonged exposure to dental plaque will lead to chronic inflammatory gingival enlargement. Whereas the genetic influences will be associated with idiopathic gingival enlargement, and if there is any external physical trauma, it will be associated with acute inflammatory gingival enlargement, whereas chronic inflammatory gingival enlargement is caused by prolonged exposure to dental plaque. Okay, if there is a prolonged exposure to dental plaque, it will lead to chronic inflammatory gingival enlargement similar to gingivitis. Okay, uh, this is the image of chronic inflammatory gingival enlargement. Here, interdental papilla and marginal gingiva is most commonly affected. Mostly the interdental papilla will be more commonly affected, followed by marginal gingiva also. The lesion will be very uh, the lesion will be very reddish in color, okay, due to presence of a high inflammatory cell component and all. And some cases it will be firm also. If there is a less number of inflammatory cells and there will be more number of fibrotic component, then the lesion will be, or the enlargement will be pink in color. Otherwise, if there is a increase in number of inflammatory enlargement, if there is an increase in number of chronic inflammatory enlargement, there will be increase in number of inflammatory cells and it will be red in color. If there is a less number of chronic inflammatory cells and there is a less number of less number of chronic inflammatory cells and more number of collagen fibers and connective tissue, granulomatous tissue are present, then this will lead to firm enlargement. Okay, it will be enlargement will be firm. Therefore, the answer will be C. Only the prolonged exposure to dental plaque will lead to chronic inflammatory gingival enlargement. Okay. Third question is the most common site of gingival enlargement due to mouth breathing. Actually, in mouth breathing, there will be the maxillary anterior region. Okay, the maxillary anterior region will be more prone for dehydration. This dehydration will have effect on irritating effect on the maxillary facial gingiva, and therefore the maxillary anterior region is the most common site of gingival enlargement due to mouth breathing. Okay, maxillary anterior region is the most common site of gingival enlargement due to mouth breathing. Answer should be B. Here you can appreciate from this picture that in relation to posterior and all, there won't be any gingival enlargement, but in the case of mouth breather, only in the facial part of the maxillary anterior, facial gingiva of the maxillary anterior is more exposed to the dryness due to mouth breathing. Therefore, this part will be more commonly affected in a mouth breather. Whereas in lower facial gingiva of the lower anterior center, it's not relatively not affected. Whereas only in the facial aspect of the maxillary anterior gingiva, it is more commonly affected. Okay, in mouth breathing, it is more commonly affected. Therefore, the answer should be D. A localized, painful, rapidly expanding lesion that is usually of sudden onset. Gingival hyperplasia and gingival hypertrophy, and won't be a rapidly expanding lesion. Okay, it won't be a rapidly expanding lesion. It is just a chronic condition. Okay, gingival hyperplasia and gingival hypertrophy usually is a chronic condition. It won't rapidly expand and all. Whereas gingival ulceration won't be associated with rapidly expanding lesion. Whereas in case of gingival abscess is commonly associated with localized in the area where the food infection occurs. There is infection of popcorn kernel. It will lead to localized, painful, rapidly expanding lesion, and the abscess will be usually of sudden onset, and the gingival abscess will be usually involves the marginal gingiva and interdental papilla. Okay, marginal gingiva and interdental papilla is more commonly affected, whereas in periodontal abscess, attached gingiva will be commonly affected. Okay, attached gingiva will be commonly affected. Therefore, answer should be C. Here you can appreciate in this picture. Okay, it is the case of gingival abscess presented with an expanding lesion in relation to interproximal region due to impaction of wound. Okay, and the gingival abscess is generally limited to, as I already told, it is generally limited to marginal gingiva. It is generally limited to marginal gingiva and interdental papilla. Okay. Therefore, the answer should be C. For a gingival abscess, it is generally limited to marginal gingiva and interdental papilla. Okay. If it is case of a periodontal abscess, then the answer should be D. Okay, because attached gingiva will be involved in periodontal abscess, whereas the marginal gingiva and interdental papilla is commonly involved in gingival abscess. Okay, answer should be C. A sinus opening onto the gingival mucosa along the length of the root and covered by small pink bead-like mass of granulation tissue. Okay, there is a sinus opening present, then it should be a chronic condition. Okay, there is sinus opening present, it should be a chronic condition. If it is present along the length of the root, okay, and it is present on the gingival mucosa, okay, the sinus opening is present on the gingival mucosa, then it definitely should be a chronic condition and a periodontal condition also. It won't be an acute periodontal abscess or periapical abscess or gingival abscess, because only chronic periodontal abscess will be presented with sinus opening on the gingival mucosa along the length of the root. Okay, and this opening will be covered by a small pink bead-like mass of granulation tissue also. Therefore, the answer should be D. Chronic periodontal abscess. Which of the following drugs induce gingival hyperplasia? Okay, Phenytoin. Phenytoin is a anti-convulsant drug. Okay, it is a anti-convulsant drug, and cyclosporine is a immunomodulator drug. Okay, immunosuppressant. Cyclosporine is a immunosuppressant, and Nifedipine is a calcium channel blocker. All these three drugs, okay, as I already told in the classification, anticonvulsant, immunosuppression, and calcium channel blockers are all involved with drug-induced gingival hyperplasia. Okay, drug-induced gingival hyperplasia will be present in all these conditions. Then in this slide, we are going to discuss about some important points regarding the gingival enlargement associated with Phenytoin therapy. Okay, normally in drug-induced gingival enlargement, it usually initially affects the interproximal gingiva. Okay, bead-like enlargement, firm bead-like enlargement will be present. Okay, firm bead-like enlargement will be present. Of interdental papilla will be present. In the second stage or grade 2, marginal gingiva also will be affected. Okay, grade 2 marginal gingiva will be affected. You can appreciate in this image B. Okay, it involves both the facial aspect as well as the palatal aspect also. Whereas in chronic inflammatory enlargements and all, mostly facial part of the gingiva will be more commonly affected. Whereas in the gingival enlargement associated with Phenytoin therapy, the interdental papilla and marginal gingiva of both facial gingiva as well as palatal or lingual gingiva also will be affected. Sometimes due to the presence of gingival enlargement, the patient will find difficult in maintaining. Therefore, plaque accumulation will be present in such cases. Therefore, inflammatory component also will be present. Normally, it will be present only with the enlargement. Okay, fibrotic component only will be present. Sometimes there is accumulation of plaque and there is a inflammation of the gingiva. Then inflammatory component will be present. In such cases, it is called combined enlargement. Okay, the image C represents the combined enlargement, and it has both inflammatory component as well as fibrotic component also. Okay, inflammatory component as well as fibrotic component. Here you can see in this histopathological examination, okay, histopathological view. Here there will be elongation of retipex will be present. Okay, you can appreciate elongation of retipex will be present, and acanthosis also will be present. Okay, hyperplasia and acanthosis will be present, and there will be an increase in amount of stroma. Okay, increase in amount of stroma on the connective tissue, and there will be deep retifex. Okay, increase in stroma of the connective tissue and increase in collagen fibers will be present and increase in connective tissue will be present, and there will be a extension of deep retifex from the epithelium into the connective tissue. There will be an extension of retifex from the epithelium into the connective tissue. Okay. Here in case of cyclosporine associated gingival enlargement, the first image represents the mild enlargement. Okay, mild enlargement will be present. In phenytoin enlargement, young people will be affected. Okay, in phenytoin enlargement, young people will be affected. Whereas in cyclosporine associated gingival enlargement, mostly children will be more affected. Okay, mostly children will be more affected. In some cases, there will be mild enlargement, but in many cases there will be generalized enlargement will be present. As in case of cyclosporine associated gingival enlargement, generalized gingival enlargement will be more common. Okay, it will be affected in most areas, and it will also involve first the interdental papilla as well as the marginal gingiva. Um, in some cases, more severe enlargement will be seen if the patient is taking both cyclosporine as well as calcium channel blockers, because in some patients who hypertensive patients who had undergone renal transplantation, this patient will take both cyclosporine as well as calcium channel blockers. Okay, then there will be more severe enlargement in such cases. The patient is taking both the drugs. This is the image. Okay, there will be inflammation. Inflammatory cell infiltrate will be very high. Inflammatory component will be very high in cyclosporine associated gingival enlargement, and abundant vascularization also will be present. Whereas in phenytoin associated gingival enlargement, less vascularization will be present, and there will be more fibrotic component will be present. Whereas in case of cyclosporine associated gingival enlargement, there will be increased vascularization and increased inflammatory component will be present, and there will be increased inflammatory cell infiltration also will be present in case of cyclosporine associated gingival enlargement. Okay, cyclosporine associated gingival enlargement. Therefore, the answer should be D. Okay, phenytoin, cyclosporine, and nifedipine are all the drugs associated with drug-induced gingival hyperplasia. Next is the tuberous sclerosis. Okay, tuberous sclerosis is commonly seen in associated with vascular fibroma. Okay, tuberous sclerosis is a hereditary inherited pattern. Okay, hereditary inherited pattern of gingival enlargement. It presents with hereditary inherited pattern of gingival enlargement. Commonly, it presents with the triad of epilepsy, mental deficiency, and cutaneous angiofibromas. Okay, commonly it will seen with the presence of epilepsy, mental deficiency, and cutaneous vascular fibromas will be present. Therefore, the answer should be vascular fibroma. In this slide, we can discuss about tuberous sclerosis. It's just an inherited disorder with inflammatory enlargement. Commonly, it presents with a triad of the presence of the triad of epilepsy, mental deficiency, and cutaneous angiofibroma. Okay. Here in this slide, we are going to discuss about idiopathic gingival enlargement. Okay, it is a rare condition. Here, normally in phenytoin-induced gingival enlargement, it involves marginal and interdental papilla commonly. Okay, whereas chronic inflammatory gingival enlargement also, these areas will be more commonly affected. Whereas in case of idiopathic gingival enlargement, marginal gingiva, interdental papilla, and attached gingiva also will be affected. Okay, marginal gingiva, interdental papilla, and attached gingiva also will be affected. So these are some of the synonyms of idiopathic gingival enlargement. First will be gingivomatosis, elephantiasis, idiopathic fibromatosis, hereditary gingival hyperplasia, and congenital familial fibromatosis. Okay, these are all the synonyms of idiopathic gingival enlargement. You can appreciate in this picture clearly that all the three parts of gingiva will be affected. Marginal, interdental papilla, as well as attached gingiva will be affected in both cases. Okay. Commonly, associated with bacterial plaque. Okay, plaque formation is also one of the important initiating factor of idiopathic gingival enlargement. This can be proved because after extraction of the tooth, the idiopathic gingival enlargement will be subsided. Okay, there will be a decrease in the size of idiopathic gingival enlargement once the tooth had been extracted. Due to this fact, they are commonly mentioning that plaque is also one of the important initiating factor in idiopathic gingival enlargement. Okay, histopathology reveals the presence of increase in amount of connective tissue. The tissue will be firm. Okay, in case of idiopathic gingival enlargement, tissue will be firm. Therefore, it will be relatively avascular, and there will be increase in dense collagen bundles and numerous fibroblasts. Okay, there will be increase in dense collagen bundles and numerous fibroblasts, and surface epithelium is thicker and acanthotic with elongated reticulates. Okay, the surface epithelium will here also the surface epithelium is thickened and acanthotic with elongated reticulates. This is a phenytoin-induced gingival hyperplasia. Phenytoin-induced gingival hyperplasia is absent in edentulous spaces. Okay. Normally, in phenytoin-induced gingival hyperplasia will be absent in edentulous spaces. Therefore, absent should be D. And conditional gingival enlargement is usually not present in hormonal, leukemic, granulomatoid or drug-induced. Okay. Hormonal leukemic, here the gingival enlargement will be usually associated with some systemic conditions as well as some systemic disease also. In granulomatoid is also a non-specific conditional gingival enlargement, whereas drug-induced will be become under drug-induced gingival enlargement. Okay, therefore the answer should be D, as both A, B and C are all associated with the condition enlargement. The option should be D, drug-induced gingival enlargement. Here the condition enlargement, it usually occurs when the systemic condition of the patient exaggerates or disturbs the usual gingival response. Normally, these conditions will exaggerate or disturb the usual gingival response to the dental plaque. Bacterial plaque is very necessary for initiation of this type of gingival enlargement. Okay, bacterial plaque is very necessary for the initiation of this type of gingival enlargement. And the three types of conditional gingival enlargement are hormonal, which includes pregnancy and puberty; nutritional, it is associated with vitamin C deficiency; and allergic plasma cell gingivitis. Okay, non-specific conditional enlargement, the pyogenic granuloma is also seen. The highest incidence of leukemic gingival proliferative lesions is present in acute monocytic leukemia, acute chronic monocytic leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. Commonly in leukemia, clinical features will be enlargement will be diffuse or marginal. Okay, the enlargement will be diffuse or marginal. It will be sometimes it will be localized or sometimes it will be generalized also. It will be usually as a present as a diffuse enlargement of gingival mucosa. That is marginal attached gingiva and interdental fibula all will be affected, and there will be oversized extension of marginal gingiva or discrete tumor-like interproximal mass. Okay, sometimes in presence in case of some lesions, it will be localized discrete tumor-like interproximal mass also will be present, or it will be present as a oversized extension of marginal gingiva. Okay, the gingiva will be bluish red and has a shiny surface. Okay, as you appreciate, the gingiva will be shiny and there will be bluish red also will be present. This is due to the inflammatory cell infiltration, and the consistency will be moderately firm, and there will be a tendency towards friability and hemorrhage also. Okay, moderately firm, not fully firm, moderately firm, and there will be a tendency towards friability and hemorrhage. And in histopathology, there will be various degrees of chronic inflammation. Okay, various degrees of chronic inflammation will be present with mature leukocytes. Okay, in case of chronic leukemias, chronic inflammation with mature leukocytes will be present. Whereas in case of acute monocytic leukemia and acute lymphoblastic leukemia, there will be the areas of connective tissue will be infiltrated with dense mass of immature and proliferating leukocytes. Okay, immature and proliferating leukocyte will be present in acute monocytic and acute lymphoblastic leukemia. Here the answer will be acute monocytic leukemia, as there will be a high incidence of leukemic gingival proliferative lesions. Okay, in acute monocytic leukemia only there will be a high incidence of leukemic proliferative lesions followed by acute lymphocytic leukemia and chronic conditions. Okay, acute monocytic leukemia will be presented with increased gingival proliferative lesion followed by acute lymphocytic leukemia and chronic conditions. Okay. In case of combined enlargement, the primary component will be hyperplasia of connective tissue and epithelium, inflammation of connective tissue, both of the above. Okay. In case of combined enlargement, there will be a increase in the size of gingiva. Fibrotic component also will be increased. This is due to the hyperplasia of the connective tissue and the epithelium, and the inflammatory component also will be increased. Therefore, the term is used combined gingival enlargement, which will be present both with fibrotic component as well as the inflammatory component. Therefore, the answers will be C, both of the above. In case of leukemic gingival enlargement, it is not found in children, edentulous patients, and patients with chronic leukemia, both PNC. Commonly, leukemic gingival enlargement will be found in children. It won't be age predilection at all. It won't be present. Okay, it will be present in children also. The patient children is affected with leukemia, then gingival enlargement will be present. But in case of chronic leukemia and edentulous patient, leukemic gingival enlargement won't be present because chronic leukemia won't be manifested commonly with the leukemic gingival enlargement, and in edentulous patient there won't be any accumulation of plaque. Therefore, there won't be any initiating factor will be present. Therefore, the answer should be D, because in edentulous patients and patients with chronic leukemia, leukemic gingival enlargement is not present. Answer is D. And in pregnancy, the gingival enlargement tends to be more prominent in interproximal areas and on the facial surfaces, on lingual surfaces, equal enlargement on all surfaces. Before going into the answer, we will discuss about gingival enlargement in pregnancy. Okay, actually the gingival enlargement in the pregnancy will be conditional gingival enlargement. Okay. The enlargement will be marginal. Sometimes it will be marginal, or sometimes it will be generalized, sometimes it will be single, or sometimes it will be present with a multiple tumor-like masses. There will be an increase in levels of both progesterone and estrogen. Okay, in pregnancy, why this enlargement is occurs in commonly in pregnancy? Because there will be hormonal increase will be there. Okay, there will be an increase in levels of both the progesterone and estrogen. In case of pregnancy, there will be 10 to 30 times increase in level of both hormones, and because of hormonal changes, there will be increase in vascular permeability, which will lead to increase in edema, and there will be increased inflammatory response to the plaque. That's why there is more enlargement in present in pregnancy patients. Okay. And in case of marginal enlargement, this marginal enlargement will be occur during pregnancy. It will be due to aggravation of previous inflammation. Actually, in some patients, if they are present with local irritating factors along with gingivitis, okay, when such patient becomes pregnant, there will be aggravation of previous inflammation, which will lead to marginal enlargement. Okay, it won't occur without the presence of bacterial plaque. That is, the bacterial plaque is very important for marginal gingival enlargement. Okay, marginal gingival enlargement varies considerably. Mostly it will be generalized, and it will be more prominently on interproximal surfaces. Okay, interproximally marginal gingival enlargement more commonly it will occur. The color of the marginal gingival enlargement will be bright red or magenta, and it will be soft and friable. Because soft and friable, because there will be more inflammatory component in presence of pregnancy. Okay, marginal gingival enlargement in pregnancy will be present with more inflammatory component, and there will be spontaneous bleeding also will be present, or sometimes provoked bleeding also will be present. The answer should be for the above question is interproximal gingiva. The interproximal gingiva will be commonly affected in pregnancy-induced gingival enlargement. Okay, pregnancy condition gingival enlargement, interproximal gingiva will be more commonly affected. Okay, localized purulent inflammation in the periodontal tissues. Okay, it's also known as lateral abscess, periodontal abscess, and parietal abscess. All the three conditions refer to similar thing only. Periodontal abscess, lateral abscess, periodontal abscess, and parietal abscess are refer to same term only. That is periodontal abscess. Therefore, the answer should be all of the above. Okay. Tumor-like gingival enlargement in pregnancy usually appears after the first month of pregnancy, third month of pregnancy, second trimester of pregnancy, and first trimester of pregnancy. This is called the tumor-like gingival enlargement in pregnancy is also called as angiogranuloma. Okay, it is also called as angiogranuloma. Also called as pregnancy tumor. Okay, pregnancy tumor or angiogranuloma. It is not a neoplasm. Okay, it is not a neoplasm. It is just a inflammatory response to a bacterial plaque, and it is modified by patient's condition. Okay, only the hormonal condition modifies the inflammatory response to the bacterial plaque. Okay, it usually appears by the third month of pregnancy. Okay, after the third month of pregnancy, tumor-like gingival enlargement will be present. Okay, third month after the third month of pregnancy, tumor-like gingival enlargement will be present. Coming to the clinical features, sometimes it will be like a sessile or peduncle also. Sessile means there will be broad base will be present, and peduncle means the lesion will be attached to the tissue with the help of a stalk. Okay, and dusky red. Sometimes the color of the inflammation will be dusky red or magenta. Usually, it affects the interproximal gingiva. As you see in this picture, usually it will affect the interproximal gingiva, and then sometimes the enlargement will be flattened due to the pressure from the perioral musculature. Okay, perioral musculature, there will be flattening of the lesion will be present. Usually it will be painless, and unless sometimes painful ulceration occurs, usually it will be painless. Okay, and the surface of the lesion will exhibit numerous deep red pinpoint markings also. Okay, numerous deep red pinpoint markings also will be present. Next is the histopathology. Synonym will be angiogranuloma, and the central mass of connective tissue will be present. Okay, synonym will be angiogranuloma and the central mass of connective tissue. Numerous diffusely arranged and newly formed and engorged capillaries. Okay, histopathology you can see in the slides. There will be a more increase in central mass of connective tissue. More increase in central mass of connective tissue will be there, and there will be increase in vasculature also will be present. Okay, increase in vasculature also will be present. This vasculature will be the capillaries will be lined by cuboid endothelial cells. Okay, this will be lined by cuboid endothelial cells. Moderately fibrous trauma with various degrees of edema and chronic inflammatory cell infiltrate also will be seen. Fibrous trauma will be present, and there will be various degree of edema and chronic inflammatory infiltrate. Next is the answer for this question. Tumor-like gingival enlargement in pregnancy usually appears after the third month of pregnancy. Okay, third month of pregnancy. Exaggerated conditioned response to minor trauma result in tumor-like gingival enlargement is termed as atypical gingivitis, Gingivostomatitis, granuloma pyogenicum, and granulomatosis. Okay, an exaggerated conditioned response to the minor trauma resulting in tumor-like gingival enlargement is termed as granuloma pyogenicum. Okay, it is a non-specific condition enlargement. There will be exaggerated response to minor trauma. As in case of granuloma pyogenicum or pyogenic granuloma, there will be exaggerated condition response to minor trauma. Okay. There's non-specific condition enlargement is also called as pyogenic granuloma. It is a tumor-like gingival enlargement. It is just a exaggerated condition response to minor trauma, and there will be a discrete spherical tumor-like mass with a pedunculated attachment. There will be a discrete spherical tumor-like mass with a pedunculated attachment. Sometimes it will be a flattened keloid-like enlargement with a broad base also. Okay, flattened keloid-like enlargement with a broad base also. It is bright red or purple in color. It is bright red or purple in color, and it will be either friable or cone. The pyogenic granuloma synonym will be granuloma pyogenicum. Okay, it will be a exaggerated condition response to minor trauma. Okay. Commonly, the interproximal gingiva will be more commonly affected in case of pyogenic granuloma. Then here also some irritating factors should be definitely present. Okay, some irritating factors should be definitely present in case of pyogenic granuloma to get initiated. Okay, plaque should be a plaque and irritating factors must be present in pyogenic granuloma for the lesion to be get exaggerated. And histopathology, it is commonly present in chronic inflammatory cellular infiltration. Okay, commonly present with chronic inflammatory cellular infiltration. Endothelial proliferation also will be present, and there will be an increase in formation of numerous vascular spaces. There will be increase in formation of granulomatous tissue with chronic inflammatory cell infiltration, and numerous vascular spaces also will be present. The surface epithelium of pyogenic granuloma will be atrophic. Okay, surface epithelium of pyogenic granuloma will be atrophic and hyperplastic in others. Okay. Therefore, the answer for this question will be granuloma pyogenicum. Periodontal cyst usually occurs most commonly in maxillary canine premolar area, and the periodontal cyst also called as lateral periodontal cyst. Okay, lateral periodontal cyst it commonly occurs in the or boteroid cyst. Okay, boteroid cyst or lateral periodontal cyst it commonly occurs in the maxillary canine premolar area, maxillary incisor canine area, or mandibular canine premolar area, maxillary molar area. This periodontal cyst will be commonly present in mandibular canine premolar area. Okay, this periodontal cyst will be commonly present in mandibular canine premolar area. Therefore, the answer should be C. Okay. The other name of periodontal cyst will be lateral periodontal cyst or boteroid cyst. Okay. Next is the true leukemic gingival enlargement. True leukemic gingival enlargement, as I already told, commonly associated with acute monocytic leukemia and acute lymphoblastic leukemia. Chronic leukemia won't be present with true leukemic gingival enlargement, and this true leukemic gingival enlargement occurs more commonly in acute leukemia. Okay, true leukemic gingival enlargement occurs more commonly in acute leukemia. Most lesions referred to as epulis are neoplastic, malignant, inflammatory, and false gingival enlargement. Epulis is a generic term. Okay, it's a general common term, and it is usually designate all the tumors and the tumor-like lesions of the gingiva. Okay, tumor-like masses of the gingiva. Mostly the lesions referred to as epulis are inflammatory. Okay, epulis is a inflammatory lesion rather than a neoplastic lesion. Okay, most lesions that is commonly referred to as epulis are inflammatory rather than neoplastic. Therefore, the answer should be C. The most lesions referred to as epulis are inflammatory gingival enlargements. Which of the following is the most common malignant tumor of the gingiva? Malignant melanoma, fibrosarcoma, squamous cell carcinoma, and liposarcoma. Actually, squamous cell carcinoma is the common most malignant tumor of the gingiva. Okay, it's the most common malignant tumor of the gingiva, followed by malignant melanoma and fibrosarcoma. Okay, squamous cell carcinoma is the most common malignant tumor of the gingiva. Normally, the carcinoma will account only for less than that of 3% of all malignant tumors. That oral cancer, oral carcinoma accounts only for 3% of all malignant tumors, and the gingiva will be accounts only for 6% of oral cancer. Therefore, the chance of getting a carcinoma in gingiva will be very minimal. Okay, chance of getting a carcinoma in gingiva will be very minimal. Okay, and squamous cell carcinoma is the most common malignant tumor of the gingiva, followed by malignant melanoma and fibrosarcoma. Okay, it is commonly involves the gingiva. It will be present as exophytic lesion. Okay, exophytic growth, presenting as an irregular growth, or sometimes the squamous cell carcinoma will be present as ulcerative lesion, which appears as plaque erosive lesion. Okay, sometimes it will be exophytic growth also, presenting as irregular outgrowth. Sometimes it will be ulcerative, which appear as plaque erosive lesions. Okay. Next is the malignant melanoma. It is a rare oral tumor that tends to occur in the hot palate. Okay. Squamous cell carcinoma will be more commonly pertaining to the gingival area, whereas malignant melanoma will be present in the hot palate as well as the maxillary gingiva of the older person. Malignant melanoma is darkly pigmented. Okay, malignant melanoma is darkly pigmented, and it is often preceded by the occurrence of localized pigmentation. Okay, malignant melanoma is darkly pigmented, and it is often preceded by the occurrence of localized pigmentation. Plaque or nodular. Okay, malignant melanoma should be plaque or nodular. Sometimes it is characterized by rapid growth and early metastasis also. Okay. Sarcoma, fibrosarcoma, lymphosarcoma, and reticular cell sarcoma of the gingiva are very rare. Okay, therefore, on the descending order, we can tell malignant. In case of malignant tumors, squamous cell carcinoma is the most common malignant tumor of the gingiva, followed by malignant melanoma, followed by sarcoma. Okay, followed by sarcoma. Kaposi sarcoma, it's a type of sarcoma. It is usually occurs in patients with acute immune deficiency syndrome, that is in AIDS. Okay, it is commonly present in palate and the gingiva. Metastasis also is not very common. Okay, metastasis from other tumors to gingiva is also not common. Sometimes lung carcinoma, adenocarcinoma of the colon, and primary hepatocellular carcinoma are all associated with metastasis to the gingiva. Okay, but this metastasis to the gingiva will be very rare. Therefore, the answer should be the most common malignant tumor of the gingiva will be squamous cell carcinoma. Okay, most common malignant tumor of the gingiva will be squamous cell carcinoma. Peripheral giant cell granuloma. There are two types of peripheral giant cell granuloma. Okay, giant cell granuloma is of two types: peripheral giant cell granuloma and central giant cell granuloma. Here the question is, peripheral giant cell granuloma occurs most frequently on interproximal areas. Okay, it occurs most commonly on interproximal areas, labial surface, lingual surface, and the caul area. Peripheral giant cell granuloma arise interdentally or from the gingival margin. Okay, it occurs either from the interdentally or from the gingival margin. But the peripheral giant cell granuloma occurs most frequently on the labial surface. Okay, and will be sessile or peduncle also. Okay, peripheral giant cell granuloma will be most frequently present on the labial surface, and it will be sessile or peduncle. It varies from smooth regular outline mass. As you see in the picture, it will be a smooth regularly outlined mass to irregularly shaped. Okay, to irregularly shaped multilobulated appearances with a surface indentation and painless. Okay, it will be firm or spongy, and the color varies from pink to deep red or purplish blue. It has a numerous pocket of multinucleated giant cells, hemocytic particles in a connective tissue stroma. Overlying epithelium will be usually hyperplastic with ulceration at the base. Sometimes the central giant cell granuloma will be present with lesions arise within the jaws. Okay, peripheral granulomas will be present on the gingival surface on the labial aspect of the gingiva, whereas central giant cell granuloma will arise within the jaws. Okay, they occasionally create a deformity on the jaw that makes the gingiva to appear enlarged. Therefore, the peripheral giant cell granuloma occurs most frequently on the labial surface B. Pregnancy gingivitis is commonly associated with increase in levels of pivotal intermedia, whereas in case of puberty associated gingivitis, it is commonly associated with Campylobacter species. But in case of pregnancy gingivitis, it is usually associated with increase in levels of pivotal intermedia. Which type of gingival enlargement is seen in puberty? In case of puberty, both the interdental papilla and facial gingiva are commonly enlarged. Okay, as we already discussed, the interdental papilla and facial gingiva both are enlarged in case of puberty. Therefore, the answer should be B. As you can see clearly in this picture, okay, interdental papilla and marginal gingiva are commonly associated with enlargement in puberty. It appears in case of plaque accumulation, and there will be increase in capnocytophagus species, and sometimes there will be increase in pivotal species also. But mostly in case of puberty, increase in capnocytophagus species will be commonly present. This question will be a significant immune finding in pregnancy gingivitis is PMN chemotactic effect, occurrence of immune complexes in the tissues, no significant findings reported, and elevated antibody levels to pivotal gingivitis. Okay, actually there will be no significant immune findings present in pregnancy gingivitis. Okay, therefore the answer should be C. Bleeding, swollen gingiva, and loosened teeth are all the common features of Beri-beri Ariboflavinosis, that is vitamin B2 deficiency, and scurvy and pellagra. Okay, bleeding, swollen gingiva, and loosened teeth are all common features of scurvy, that is due to vitamin C deficiency. Vitamin C deficiency associated enlargement is a classic symptom of scurvy. It is a conditional response to bacterial plaque. Actually, the acute vitamin C deficiency won't itself cause gingival enlargement, but the presence of bacterial plaque, that deficiency will cause a conditioned response. Okay, but in case of vitamin C, it is associated with hemorrhage, collagen degeneration, and edema of the gingival connective tissue also will be present. Combined effect will be seen commonly in patients with vitamin C deficiency. There is a presence of very much inflammatory component due to increased accumulation of plaque. Usually in vitamin C deficiency, it will commonly affect the marginal gingiva. Okay, the gingiva will be bluish red, soft and friable, and has a smooth shiny surface also. The hemorrhage occurs either spontaneously or on slight provocation. Surface necrosis with pseudomembrane formation also will be present. As you see clearly in this picture, pseudomembrane formation also will be present between these two tooth. Okay, you can clearly see the pseudomembrane formation will be present. This is due to the poor blood supply to the poor nutrition supply to the epithelium. Okay, therefore pseudomembrane will be formed in case of vitamin C deficiency. Coming to the histopathology, chronic inflammatory cellular infiltration will be present. Scattered areas of hemorrhage with enlarged capillaries will be present, and diffuse edema also will be present. There will be scarcity of collagen fibrils or fibroblasts will be present because collagen formation will be poor in case of vitamin C deficiency. Therefore, the answer should be C. Okay, bleeding, swollen gingiva, and loosened teeth are all the common features of scurvy. Thank you.